Thank you, members of the Society, for giving me this opportunity to share with you our work on implementation research in nutrition. The talk that I'm giving today was originally presented at a South Asia Regional Conference on Addressing Wasting, which was held in Kathmandu and hosted by UNICEF. It's called the No Time to Waste conference, and I was asked to speak about how we've been doing implementation research in the context of nutrition and reflecting a little bit on how implementation research itself can inform where work needs to go in terms of scaling up solutions to prevent and treat wasting in the region. Now, the objectives of my presentation today are to help connect nutrition interventions to delivery platforms and define implementation research the way we see it as a linkage between these two. I'd like to showcase a few examples of implementation research we've done on nutrition from the projects that I mentioned before. And then in the context of this particular presentation, which was on addressing wasting in South Asia, I'd like to reflect a little bit on some of the challenges and the opportunities that lie before us in terms of this particular space of working on nutrition. So moving on to the first component, which is around definitions and sort of the rationale for why we care so much about implementation research in nutrition. Firstly, in terms of definition of terms, if you look on the left side of the screen, the interventions, these are just some examples of interventions that are listed here, are really the things that we want to get out there. These are tried and tested solutions with a lot of efficacy research behind them. And the challenge that lies ahead now is taking some of these solutions to scale. So the interventions can range from simpler interventions such as iron folic acid supplements or provision of zinc tablets with oral rehydration salts or food supplements to things that are a little bit more complicated in terms of such as information and messages or nutrition counseling, treatment protocols for malnutrition, agricultural interventions such as kitchen and home gardens. These interventions then need to be connected into what you see on the right-hand side, which is delivery platforms, which are the ways in which we can get these things out there. So how do you get iron folic acid supplements out to communities or to pregnant women who should be consuming them? You do that through antenatal care contacts, which can be either through primary healthcare centers or through outreach by community health workers. How do you get nutrition counseling out there? They're often through well child checkups or growth monitoring checkups at primary healthcare centers or community outreach programs by home visits, using home visits with health workers. How do we get information and messages out there? Again, often through outreach programs or mass media campaigns. How do we get treatment protocols for severe malnutrition out there, either through facility-based or community-based platforms for treatment? And the rubber really hits the road in between this intersection of interventions and delivery platforms. And this is where implementation research and the kind of work that we're doing really comes in. Now, most of the work that I'll speak about today relates to nutrition counseling as the key intervention, but you'll see that the examples that I have actually look at how you get that one intervention out through multiple delivery platforms. So I'll speak about that a little bit later. Now, the situation around the scale and the reach of these types of interventions in South Asia is very mixed. This is some very new work from Aksir et al., which was just published in a special issue of the British Medical Journal on South Asia earlier this year. And this particular graph basically shows you the reach and the scale of multiple interventions across the first 1,000 days, and then a little bit more into early childhood. Each bar there represents the average for the region, and the pattern dots around each bar show you the variability in the reach of those interventions for each country in the region. So what you see, for example, here is that there's a lot of variability, both across interventions and across countries. These are all interventions for which coverage should be close to 100%. And what's really essential for us to look at is to really dig in here now and start to understand why for certain interventions or in certain countries you see such a variable situation. From the perspective of the issue that this talk was given under, which is wasting in South Asia, what's really important to note here is that, in fact, there is no standard coverage indicator related either to screening or to treatment for severe wasting. And so that's something that actually we have no data on. We have no coverage data on how well the countries in South Asia are doing on either screening or treatment for severe wasting. In some work that we've done in India, what you see is that, in fact, the variability in coverage. Now, this particular slide shows you the coverage in the same types of indicators, but now digging into one country in South Asia. And in this particular graph, every bar is the national average for India, and every dot is a state in India. And the green bars are all interventions during pregnancy. The orange bars are interventions in the first 6 months of life. And then the purple bars are the interventions in early childhood. These types of graphs are extremely revealing because they really help us see where, for example, you have a high national average, but still a reasonable amount of variability in across the different states. For example, the interventions in pregnancy are largely around there. They also help you see where things are really not going well, even at the level of a national average. What's again interesting here is that there is right now no information on the reach or coverage of treatment for either screening or treatment for severe acute malnutrition. But in the context of India, the national DHS does have some information on screening, which will ultimately be available, and we'll know a lot more about how well the first sort of entry point into treatment protocols, which is the screening, is doing. We use these kinds of coverage graphs a lot in our diagnostic work in the region, and we use that because they really help us understand what the reach of these interventions looks like, and it creates some very useful conversations about where things are going well and where things are not going well. The challenge, of course, is that they don't really tell you why. This is where implementation research comes in, because it forces us to look at data like this and say, why are we seeing this gap in between the interventions that we know should be in place and the outcomes at the other end, which is the reach, the scale, and the impact of those interventions. And so the whole point of and the investments that we're making in doing implementation research are around opening up this particular black box of implementation. Now, you've probably seen from the work that the Society for Implementation Science in Nutrition has been putting out, the link between those interventions on the one hand and outcomes on the other hand. And certainly we include outcomes such as reach, coverage, as well as outcomes such as nutritional status when we look at that. But that set of outcomes really depends on this core of things that have to come together in the middle for the interventions to reach client populations and then for them to be used effectively by client populations. So it includes things such as the characteristics, capacities, and all of the dynamics that occur between and within implementing organizations, the actual frontline implementers, such as frontline workers, supervisors, managers, the clients and communities that are intended beneficiaries of these interventions and that must engage with and use these interventions effectively. And of course, all of this within a larger enabling environment. Where we come at this from is that there's a ton of things that can affect whether an intervention reaches client populations and has an impact, and that all of these things are really important to pay attention to in the context of research. This particular work from the society, I'm just going to click through so that we get through to the end, really helps us see that there are many different things that have to come together here, such as the kinds of interventions, which is objects of implementation, and then of course the implementing organizations, the kinds of processes that the implementers start to engage with and roll out in the context of scaling up these interventions, and then a variety of things around the individuals and communities. I think what's noteworthy for me in particular in this framework is that there is so much variability just around the objects of implementation. I mean, the list that I showed you before is just a list of mostly nutrition-specific interventions. And if you really start to think about it, you realize that delivering a set of supplements has a very different set of asks around implementation and utilization than even delivering nutrition counseling. And in fact, the two are both bundled together as nutrition-specific interventions, but in fact, they have very different characteristics that will affect how they are taken up and rolled out by the implementation systems. So just keep that in mind. I mean, most of the examples that I'm going to share with you are more around nutrition behavior change, but there is quite a lot of work also being done on things like supplements. So implementation research then for us is really a systematic approach to understanding first, and then addressing the barriers to effective and quality implementation of nutrition interventions, strategies, and policies. And what I hope to convey to you through this presentation is that we have to think really hard about characteristics of the intervention and characteristics of the delivery and utilization context in how we approach implementation research and in the kinds of things that we have to do both to study, but then also later to address these types of barriers. In our experience, implementation research studies take a very wide range of research studies. They can include formative research studies, they can include process evaluation studies that are linked into impact evaluation. They may include experimental studies, testing innovations in implementation, but looking only at operational endpoints such as quality of service or coverage, but not going all the way to nutritional status. They could include standalone operational assessments where you just, you end up going in once or twice to just look at how systems are delivering certain interventions and to diagnose, in a sense, where things can be fixed. But they also include things like costing studies, use of creative approaches to routine monitoring. We've also been doing quite a lot of work on implementation-focused analyses of secondary data. Now, in the examples that I'll give you today, they are mostly process evaluations nested into impact evaluations and standalone operational assessments. But there's really a range of studies, which means that you can come at implementation research from either a quantitative or a qualitative or an anthropological or implementation or economic perspective and still add a lot of value to helping understand this gap between interventions and the outcomes. In the context of the work that we've done on Transform Nutrition, Stuart Gillespie, Andrew Kennedy, and I did a literature review looking across multiple different frameworks for scaling up. And we identified 9 key elements that really seem to emerge across all of these different frameworks, and have since then done some work to look at how well this framework itself can be applied. But in the context of this particular talk, I just want to hone in on items 2 and 3, which we identified as really critical to scaling up impact on nutrition. And that's where a lot of work that we've been doing on implementation research is coming together. So this is, the link between intervention characteristics and the operational context in which interventions are rolled out. And just to give you a little bit more information on what that actually looks like and how we might think about that from an implementation research perspective, we really sort of tried to line up the complexity issue here, which is that you have a range of complexity both for interventions and for intervention delivery context. What we've come to realize in the context of looking at multiple interventions in multiple delivery contexts is that scaling up, just in terms of getting interventions to reach people, is highly dependent on operational context and really on this intersect between intervention complexity and the complexity of the delivery or implementation context itself. And that implementation research really needs to help shed light on this intersection. So just to give you an example, a simple intervention in a simple context, an example of that could be vitamin A supplementation through a campaign-based modality where you literally mobilize the troops twice a year to get this simple intervention out and are able to deliver that very effectively. A complex intervention in a system where you may have a little more control is, for example, a complex multi-component behavioral change intervention, which is delivered through a community-based, nutrition-focused NGO program platform. A simple intervention in a complex context could, for example, be the same intervention I mentioned earlier, which is something like a vitamin A supplement, but being delivered through what can be not a campaign, but a multi-purpose, multi-tiered government health system that tries to deliver these simple interventions through routine care systems that can actually be quite complicated. In the context of this particular discussion on the prevention and treatment of severe acute malnutrition, though, what we have is really a complex intervention intersecting with a complex context. And in many cases, it looks like it's a simple intervention. We all speak about things like community RUTF for community-based management of severe acute malnutrition. But in fact, it's a very complex intervention because RUTF is not the intervention. What you're looking at in terms of the intervention there is what's highlighted in red on the screen, which is an integrated continuum of care for screening, identification, referral, treatment, follow-up, and management of severe acute malnutrition. When this is done in routine systems, as opposed to, say, emergency delivery systems in a refugee crisis, it has the added complexity of having to be delivered through multi-purpose and multi-tiered government health systems. So on the one hand, while we have an intervention that is potentially effective, actually putting it in place can be quite complicated. And so when I close up, in the end, I will come back to what implementation research might look like around this particular continuum. Now, some challenges that we've encountered with implementation research are that the best place, of course, to do this research is within and with programs or interventions that are being implemented within systems. Some of the challenges that this poses are that it really requires some careful reconciliation of research objectives and values with program implementation objectives and values. And it can relate to things like, how do you set up comparison groups and programs that are going to scale? How do you manage the timing of, when the research is done versus when the results come back to implementers to take up the results? It actually requires substantial and adequate funding because implementation research is done in close collaboration with program implementers. And what that means is that you need to have the researchers themselves engaged with these research processes for a long time, which means that there has to be adequate funding to ensure that you have this continuity of engagement and over long periods of time. The other challenge with implementation research is often funding for these reasons can be somewhat limited, but you can also have significant publication biases because a lot of the research that one ends up doing can be seen as contextually specific rather than producing generalizable insights. And it's always a challenge for researchers to find that balance in terms of delivering research that is then taken up for publication in appropriate journals. And I can say we're certainly exploring a much wider landscape of journals to publish nutrition-focused implementation research in than just the nutrition journals, because nutrition journals have not been traditionally oriented to this kind of work. But there are many other journals out there. And last but not least, it's really challenging to figure out how best to account for contextual factors in the context of doing and interpreting the results of implementation research. I'd like to acknowledge several research collaborators who I've been working with over the last several years.